I'm Dr. Carroll. I'm an endocrinologist with the Froedtert Medical College of Wisconsin Endocrinology Center. I'm originally from Janesville, Wisconsin. I grew up there and then went to undergraduate at the University of Wisconsin-Madison. Then came to Milwaukee in the medical college in 1998, where I have completed all my medical training, including medical school, internal medicine residency, a year as a chief medical resident, and then an endocrinology fellowship. And then I've stayed to practice endocrinology with the Froedtert Medical College of Wisconsin. As an endocrinologist, I see patients with thyroid disorders, disorders of the adrenal glands and the pituitary gland, and also patients with diabetes. I have a particular interest in patients with pituitary and adrenal gland disorders, especially Cushing's disease. It's a rather unusual disease, but we see quite a few patients with it. I do see patients with diabetes rather frequently. Because of the large number of patients with diabetes, probably half of my practice is patients who have diabetes. I think it's an important part of my practice to make sure that patients are well informed about their conditions. Often patients with endocrine problems have very complex history and complex diagnosis, so I think it's very important for patients to understand their diagnoses, and then also any testing or treatments that we've suggested to the patient. I take extra time to explain all those tests and treatments that we might offer patients, and then make sure that they have ample time to ask questions so that they can really understand what's going on. I also make sure that patients leave each visit with a written instruction of any testing that we've asked them to do, and also any new treatments that they might be asked to begin. I think that's an important part, to make sure that patients have that they can refer to after their visit. I enjoy working with the medical college for several reasons. The access to be able to have patients see a range of specialties, including nurses, mid-level providers such as physician's assistants, and nurse practitioners, really a full range of services that are available. Also, the ability for patients to be involved in research, if there are clinical trials that could benefit the patient. Those resources at the medical college and Froedtert are really excellent. And then I personally enjoy teaching, and to have medical students and medical residents who rotate with us. I think it's important that we train future physicians, and the patients are really an important part of that.